November is Diabetes Awareness Month, and here to give us some of the statistics and resources on how we can delay or prevent diabetes is our friend Merritt Bates Thomas from Green River District Health Department. She's not cooking for us today, but she's going to talk about food.
I am. Briefly.
Well, you know, of course, diabetes is a problem in our community and around the nation, which is why this is, you know, the month to focus on it. What are you, from the department, what are you trying to help people see in this month of raising our consciousness?
Well, I think first and foremost, there are different kinds of diabetes. Type 1 can't be prevented. Type 2 can be prevented or delayed, so there's a difference. But in terms of management, the strategies are pretty much the same. We talk about diabetes so much because it impacts so many people.
It does.
1 in 3 Kentucky adults has prediabetes. Only 1 out of 10 remembers being told they have it. So that highlights the significant importance of just being more of your own advocate and becoming more aware, asking the right questions. Starts with knowing your numbers, as we've talked about many times on the show before. But the A1C, which relates to an overall measurement of blood sugar for about 3 months, your blood pressure, figures and factors in because of the impact elevated blood sugar can have on the entire vascular system. So going back, that's why knowing your blood sugar, keeping it in a healthy range is so important. Then knowing your blood pressure and also your blood lipids. So
that's the cholesterol high and low and all that
yes,
stuff, right?
Cholesterol, triglycerides, etc.
So it's a blood panel basically that you get once a year. Now this is I didn't even think about this before. Is that age related to get that full panel when you go in for your yearly checkup? I mean, I never thought to ask until it became a problem.
Yes and no. You know, I think as adults, as we become adults, advocating for ourselves and better knowing what those numbers are helps us then begin to better understand and sound an alarm if we need to, or ask better questions with our healthcare provider. And if you're starting down the road somewhere, you don't have any particular basis on which to have the questions.
Right, right.
But if you've had this history of, well, things have been going along pretty well, then all of a sudden you see some red flags, potential red flags even popping up, you can ask better, more informed questions, and the key thing can be heading things off earlier, which reduces your risks.
Yeah, and again, knowing your numbers, if you know and get that blood panel done. So what are we talking about as far as what we personally can do for ourselves to either delay it or prevent it? What are the steps we can take?
Build and maintain a foundation of healthy lifestyle habits. So again, the things we've talked about, but we still need to hear, and we need kind of that reinforcement.
Right.
Yes, I'm on the right track. So healthy eating habits, balancing the foods we eat over time, regular physical activity, plenty of sleep and rest, taking care of our bodies, good mental health check-ins, being mindful of our mental health, and when something maybe seems a little off, discussing it with the appropriate healthcare professional, and developing that healthy support system as well is so important. You know, just having outlets, friendships, different ways to connect with people and develop healthy lifestyle habits.
Can people go to your website or call and get some resources?
Go to healthdepartment.org. And then they can find information within our diabetes program. They can find helpful tips. They have a series of videos, little clips that just point them in the right direction to making these changes.
Thank you, Merritt.
Thank you.
We'll be back right after this. Please stay with us.